Some new information today surrounding the health effects from drinking regularly. Now the U.S. Surgeon General is calling on lawmakers to add warning labels to alcoholic drinks. The dangers of alcohol is the big story today. In fact, the U.S. Surgeon General is calling for updated health warning labels on all alcoholic beverages, citing the increased cancer risk. Mandy Gaither takes a look at what's behind that push.
It's a new call to warn Americans about the effects of alcohol. U.S. Surgeon General Dr. Vivek Murthy issued this advisory Friday, seeking labels on alcoholic beverages, warning of cancer risks.
The reality is that more people die every year of preventable alcohol-related cancers than drunken driving. And I think most people probably don't realize that.
Medical oncologist Dr. Dale Shepard with Cleveland Clinic says he hopes this advisory brings awareness. The Surgeon General's office says less than half of Americans are aware of increased cancer risk from alcohol and that it's the third leading preventable cause of cancer in the U.S. That risk rises with the amount of alcohol consumed.
I think in general, moderation is key.
The advisory says every year in the U.S., alcohol is responsible for about 100,000 cancer cases and 20,000 cancer deaths. It's linked to at least 7 types of cancer, including breast, colorectal, esophagus, liver, mouth, throat, and voice box.
Lifestyle changes can have a positive impact on cancer risk for heart disease, risk for diabetes. We can't underestimate the ability that we have to change our lifestyle and make ourselves healthier.
An updated warning label on alcoholic beverages to reflect cancer risk would require approval from Congress. For Health Minute, I'm Mandy Gaither.
Meanwhile, in a statement issued today, the American Cancer Society commended the advisory, saying, quote, "It is imperative that people are made aware of the potential impact of alcohol consumption and are met with recommendations on how to reduce their risk." And people inside and outside of New York City today, outside of a bar, expressing skepticism over the Surgeon General's request, saying that cancer warning labels on alcoholic drinks won't be effective.
I don't think it will make any difference. If people want to drink, they will drink regardless of any warnings.
Alcohol's been sold for many hundreds of years and it's not proven to cancer, so I can't see how they can find something to do now to start scaremongering.
I don't think it's going to make that big of a difference, putting a warning label. I would hope it would, but my gut feeling is no.
Meanwhile, January, often referred to as dry January. A lot of people decide to give up alcohol to start off the year. Doctors with the Cleveland Clinic say besides the physical benefits, there are some mental health benefits as well. For example, taking a break from alcohol can improve your mood, your confidence, and make you feel less anxious. Doctors say dry January gives people a chance to reflect on their relationship with alcohol. They may realize they were drinking a lot more than they thought, or find they can have just as much fun with friends without it.
If you do end up drinking, don't take it too personally. Get back on the track again. A slip is okay. Don't beat yourself up. I think that any reduction is better than anything.
Experts say that heavy drinkers should consult with a physician before trying dry January due to the risk of withdrawal. Symptoms can include headache, anxiety, insomnia, an upset stomach, rapid heart rate, tremors, seizures, and hallucinations. So how do you know if you actually have a problem? We have Dr. Rajiv Parinja from Mercy Health with us. There are a lot of people out there that struggle with this. So how do you determine if you might have an issue with alcohol?
That's a great question. So something which primary care physicians often use when they see patients in office is a small questionnaire. It has got 4 questions. And if you say yes to 2 of those questions, that is a very sensitive indicator that you might have a problem. Those 4 questions can be remembered by an acronym called CAGE. So the C stands for cutting down. So do you ever feel that you need to cut down on your drinking? The A stands for annoyed. So do you ever feel annoyed when other people tell you that you need to cut down on drinking? The G stands for guilty. So do you ever feel guilty about how much you drank or any consequences that came from that heavy drinking? And the E stands for eye opener, which means Do you ever need to drink first thing in the morning because you are shaking and you need to steady your nerves? Or you are having such a bad hangover that you think that you need a drink? So if you say yes to any two questions, then you may have a problem. And of course, there may be other things that are happening with heavy drinking. If you are having problems with driving, if you've had a DUI, if you have been drinking at work and running into problems, those would all indicate that you may be drinking excessively and not in control of your drinking.
Okay, so let's talk about the actual action of doing so. Any advice for those people out there who maybe said yes to two of those questions and who are looking to remove alcohol or cut back? If it's not an immediate health risk, what are some of the first steps that people should take?
So that really depends on how much you're drinking and whether you've tried to cut down on drinking before and how much success you've had. At one end of the spectrum are people who are maybe just drinking a little bit over what would be relatively safe for them. And those people can maybe make some resolutions, commitments, which they can communicate with their loved ones and see if they can cut down on the drinking and stay within the safe limits. On the other end of the spectrum, there may be people who are drinking so much that if they suddenly cut down on drinking, they will go into withdrawal symptoms and possibly even seizures. And these people should certainly not try to work this out on their own. They should seek help from a clinic or a hospital where they can be safely detoxed and then linked with further services. So depending on where you fall on the spectrum, you may want to do it on your own or seek help from a primary care physician or go to a hospital to make sure that you are safely detoxed.
Well, Dr. Provincia, thank you so much for that advice and the acronym to help some people out there.
Yeah, you're welcome.
Well, there's a new survey that finds that just because people are putting down their cup doesn't mean they're necessarily trying to be sober. Civic Science found that nearly a quarter of people who participated in Dry January just replaced alcohol with cannabis. Younger people, the most likely to say that they're consuming cannabis over alcohol, with 34% of those people ages 21 to 24 getting high while going dry. An analysis of national survey data also finds that daily and nearly daily marijuana use is now more common than similar levels of drinking all across the country.
I know that there's benefits in that. There's sometimes that you can do this, you can use this substance in definitely recreationally, the same way that we use alcohol, that we know that, 4 drinks a week is okay for women of my age. But we really don't know that for cannabis. This is not just about everybody enjoying themselves, that there's a lot that goes into this. And that, again, just like using your prescription medications the wrong way or taking too much of a supplement, there are negative consequences to using these products the wrong way.
Research shows that high-frequency users are more likely to become addicted to marijuana. And the National Survey on Drug Use and Health found that around 36% of adults ages 18 to 25 consume marijuana in 2022. That study also found that 1 in every 2 adults in the same age range have at least tried marijuana. Still, the study shows alcohol use in 2022 did exceed marijuana use, with 68% of that same age group saying they drank alcohol.